Welcome to Onslow County Today. I'm your host, Lisa Whitman-Grice, and today is about community. It's about being here for our community, and we have some wonderful guests joining us. We'll be talking with Joseph Bauer from Onslow County Planning and Development, Ashley Gordonier from Onslow County Senior Services, Tori Parks from the Onslow County Public Library. We'll also visit with the Onslow County Sheriff's Office with the Honorable Christopher Thomas, Sheriff of Onslow County, and Deputy Howard Shamel. Finally, we're going to have some conversations with our Onslow County Health Department, talking with Voni Bonney and also with Erica Giles about care management. And finally, we're going to have a very sensitive conversation and an important conversation with Becky Knudsen and Dominique Van Pelt from the Onslow County Health Department about suicide prevention. As always, we are so glad you are here with us for Onslow County Today so that we can share with you, our community, what we are here to do for you. Welcome back to Onslow County Today, and joining us now is Joseph Bauer with Onslow County Planning and Development. Joseph, thank you for being here today.
Thank you for having me, Miss Lisa.
You know, one of the things, back in 1918, North Carolina was declared the Good Road State. Never could we have imagined more than 100 years later how much pavement there could possibly be. And Onslow County has a new initiative that you all are really getting out and sharing the word about, and that is about the Orphan Roads program.
Yes, ma'am.
The first thing we want you to do, Joseph, is sort of define for us what that means.
Absolutely.
And then we'll talk about the county's plan for it. So if you could help us understand what it means for a road to be an orphaned road.
Absolutely. Yeah, so let's first define the term, what qualifies as an orphan road. So these are roads during the development of a subdivision that were designated to be public access ways.
Right.
And when they're created as public access ways, as you stated, the county doesn't maintain the roads, NCDOT does. These roads, when they're created, then have to be petitioned over to NCDOT to be adopted into their state maintenance system. And then once they reach that, then they're the state's maintenance program and the roads are taken care of. The problem is there are roads that have been created. They were designated as public, but for a myriad of reasons, failed to be petitioned to the state to be taken over in the state maintenance system.
Okay.
So now we have roads that are public, designed to be maintained by NCDOT, but are not adopted in their state maintenance system. So no one is technically responsible at this point for their maintenance and upkeep of these roads, hence the orphan. And this becomes problematic throughout the county because bad roads don't get better with time.
Right, exactly. So, and one of the things we can, for our viewers to think about is sometimes they've probably seen those little just road markers that say end of state maintained road,
yes.
Just that little green sign, and you don't think much about it.
Exactly.
And you never think about, well, then beyond this sign, who does take care of this road? Joseph, in the past, when that has happened, a road has been orphaned, there have been different mechanisms, right? So if it's in a subdivision, perhaps there's an HOA, is that what we've seen? Or have the roads just been left to their own devices?
Yeah, so these public roads were never deeded over to an HOA, as in the case of like a private road.
Okay.
They would be deeded over to that HOA, and they are responsible for the maintenance and upkeep through the HOA dues. These public roads were designed to be taken over by NCDOT, so they were never deeded over to a private entity. Therefore, they fall into a state of neglect because no one has ownership to properly maintain them at this point.
And as an area is further developed along that same roadway, homes are built, businesses, people are coming and going to and fro. As you said, roads don't get better with time. They require maintenance and upkeep. And who has that fallen to? No one?
Exactly. They've fallen in neglect, right, because no one is responsible for them, and it's become a compounding problem throughout the county. And hence, The Board of Commissioners have recognized this. They've heard public comments. They're aware of the situation, so they've gotten together to set aside $2 million worth of funds to create this innovative program to start to take the initiative to remedy this problem that's kind of ongoing.
Now, this does not mean, as we know, state does roads,
Yes.
county doesn't do roads. Some municipalities do roads, but within the county extraterritorial jurisdiction, things under the purview of the county, we don't take care of roads and haven't for decades.
That's correct.
That is not our responsibility, I should
Right,
say.
and that's actually a big piece to kind of inform the public, because we do get calls where they refer to it as the county road.
Right.
We do not have road maintenance system over these
Right.
county roads, so we rely on the NCDOT partnership to maintain these roads. Nevertheless, it becomes a county problem.
Right.
And more so, you have school buses that fail to be able to pick up children because they can't travel down a road because it has fallen in such disrepair. Emergency services, the postal service. So, and that's why the Board of Commissioners said we need to kind of get out in front of this by creating this program to where we can kind of take the initiative, and the end goal is to be able to identify the roads, tap out to our partners in NCDOT, find out what kind of repairs need to be made, do the repairs, bring it up to their NCDOT standard, and then petition the NCDOT to then take the road back over through this $2 million loan program that the Board of Commissioners have greenlit.
Right, so one of the things that we've seen is perhaps in areas where these public roads exist, there's been a development or a neighborhood established, and then the neighbors are sort of within the neighborhood, the residents have said, we want to turn the road over, we'd love to be state maintained road, but DOT does have standards.
Yeah, exactly.
And there again, they're responsible, the homeowners essentially, or that area, have been responsible for getting the road up to the DOT standards before the DOT would adopt them.
Exactly right.
So the county is providing a mechanism to assist. We're not going to go in there and do the road repair. We
That's
need to be
correct.
really clear about that. But explain how this mechanism will work, this application process and the county's role in this.
Yeah, absolutely. And I'm glad you brought that up. So the very first step, there's a lot of moving parts with this program, and there's many different steps. But the initial kickoff meeting is that's what I kind of want to share today.
Sure,
because that's going to be our
absolutely.
kickoff meeting where we can sit down with the actual community, and the meeting actually serves twofold. We want to lay out our timelines for what we anticipate how this program will look. There's different partners, NCDOT, there's also tax department plays a role, planning and development, but we also want to hear from the community because we don't know what we don't know.
Okay.
We do know already through public engagement of several problematic roadways through subdivisions. However, there are more out there. So we encourage everyone to attend that's interested, that perhaps may live off one of these roads that are not state maintained, and they're falling in a status of neglect. We want you to come on out September 10th at 6 p.m. right here in the Onslow County Government Center, because we want to hear what roads and subdivisions you may live off of that we were unaware of, and kind of start to create an inventory of the county roads that are orphaned. And then we can start to evaluate, get with our partners at NCDOT, and start to evaluate where this needs to go in order, the end goal, petitioning the state to maintain these roads.
Yeah, it's not a matter of, I called first,
Right.
my road's bad. You're going to have an entire assessment system. There's going to be a criteria, a
Yes.
matrix that you all are going to follow. But in order to do what we need to do, we need the public to come here and have a voice in that process.
Yes, that's completely correct. We need to kick off meeting September 10th. We want to hear from you. We want to hear the roads. We want to hear the subdivisions, and then create that list to where we need to direct our efforts to better serve the community.
All right, so September the 10th.
September 10th.
All right, here in the Government Center, 6 p.m.
Yes, ma'am.
For folks who have inquiries prior to that, who want to know a little bit more, how can they best reach you, reach your team there at Planning and Development in order to best prepare? Like,
Sure.
oh, do you need me to bring photographs? Do you need me
Right.
to email? You know, how can they reach out to you to prepare for that meeting?
Yeah, they can call me direct on my direct line. Joseph Bauer, I'm the senior planner for the Planning and Development Department at 910-989-3011. And I encourage anyone to reach out prior to the meeting, and you can tell me where your road is, and we can kind of talk through it, and I'll give you that invite to attend September 10th meeting, absolutely.
Fantastic. Just one last thing I want to talk to you about is you mentioned in the very beginning of our conversation that this is really an innovative opportunity. As we said, the roads are state maintained. The county stepping in this way is really a novel approach to helping our citizens. Talk about how that sort of was born, and again, why this engagement on September the 10th is so important.
Sure. I mean, it's a direct result of public engagement, coming to Board of Commissioners meetings and stating these grievances of, we have a problem here, and the Board of Commissioners recognizing it over time and saying, well, there's a problem, let's get a solution going.
There we go.
So we wanted to take that initiative, and that's what they did here in this budget cycle, set aside that $2 million worth of funds to get out in front of that problem and start to provide solutions. Because like I said, this affects school systems, postal service, emergency services, not just your daily commutes, and the individual citizen, obviously. So it is a countywide problem that needs to start to be addressed.
Very good. Well, Joseph, we thank you. We, again, look forward to learning more. We want you to come back and share with us as the project evolves and let us know how it's progressing. But for today, we really thank you for your time.
Well, I appreciate you giving me the opportunity to get this information out. So I look forward to seeing people on September 10th.
Thank you, Joseph.
Yes, ma'am.
Welcome back to Onslow County Today, and joining us now is Ashley Gordonier with Onslow County Senior Services. Ashley, thanks for being here today.
Thank you so much for everything.
You know, I was over at your site visiting a couple of weeks ago, and I said, Ashley, we need to have you on the show because you piped up and said, you know, next month is Senior Center Month.
Yes.
And I was like, okay, come on and let's talk about it. So first we want to talk about, you are new to your position relatively. How long have you been in the position?
So I've been in the position for about 3.5 weeks.
Wow.
Yeah.
And you have hit the ground running, planning this beautiful celebration. We want to talk about where our senior center is located, the services that you offer, and what makes this month so special. So first things first, you all are in a temporary location.
Yes.
Tell us where that is.
So that is out on Richlands Highway, 4955 Richlands Highway, and it is at the old Family Dollar.
Okay.
But it is so welcoming, and everyone is always happy there, so I'm so excited to be there.
Well, you know, the first thing you walk in, it's a happy color, right? It's this bright, beautiful, kind of yellow, sunshiny, and then the people are the same way. And what goes on sort of on the daily basis at our senior center?
So typically our seniors arrive, we open at 8 and we're closed at 5 and they stay all day. Oftentimes in the morning we have exercise classes, we have socialization and coffee hour. A lot of our folks will do puzzles. I often go to the puzzles and the billiards. And then in the afternoon we also have woodworking, camera club. So we have a lot going on, and for our space, we make it work because everyone gets to kind of bond together and socialize. We recently had a great success. There was an artist who was actually sketching a Domino's group. And he's also a woodworker. And so he did this whole sketch and showed me and showed the Domino's group, and they were so taken aback. And then I asked the woodworkers to make a frame, and they framed his sketch. So now we have our all groups together, and I'm like so excited about it.
I love this. They all brought their gifts and talents to the table. That is beautiful. Now, at our senior center, as we said, we have congregate meals, we have arts and crafts. You've had exercise, but that's also at sort of at some other locations right now.
Yeah.
But during Senior Center Week, you have a month rather,
yeah.
whole month. You have a special theme this year and lots of cool things planned. So what is this year's theme?
So this year's theme is called Flip the Script on Aging, which I'm really excited about because we have people through all walks of life, all different skills they bring to our table. And so our goal is to help them have support and increase their wellness every day and that socialization. We have some really cool activities going on. So our first week we have a staff versus participants volleyball game, chair volleyball.
Ooh.
So we're really excited about that. And then on the 18th, we actually have staff versus our participants cornhole.
Oh, fun.
So
Okay.
they are gearing up.
So you're going to have games. It's sort of like when you're in school and you have Spirit Week, only this is a whole month of different
Yes.
kinds of celebrations.
And we have presentations throughout the whole month.
Okay.
So they're educational and collaborative, which we're very excited about. We have services to the blind coming in. We have our very own safety officer going to do a fall prevention.
Oh, so good.
We have the Hearing and Deaf Association coming in and doing a presentation. And then we also have one of our seniors who's going to be playing at our music hour. So we're really excited to share their talents and also have that educational piece.
You know, we've mentioned the idea of socialization and folks coming from all walks of life and different life experiences. Talk about the bonds, as you say, between the seniors who are there, because we're talking about people from about a 35-year age range, 35 to 40-year age range. Is that right?
Yeah.
What's the age sort of range there that you've seen?
So I've seen from early 60s all the way up into late 90s enter our doors, and they always have a smile on their face, and they're always just looking out for each other and just looking for that ability to bond.
Okay.
So that's what's the most exciting part of my job, is just seeing how somebody who maybe is having a rough time dealing with things such as grief of their life roles, or grief of losing those, or losing family, or relocating, and just being welcomed. So we're so excited.
Well, we are excited about the celebration. Again, this is the entire month of September.
Yep.
We do want to sort of give a teeny snippet of an update while you all are in temporary locations. They can see just down the road a tremendous amount of construction going on for you all, right?
Yes.
So while we don't have a definitive date, we can look down the road and know that next year our senior center is going to even be bigger and better, right?
Correct, yeah. And even more welcoming, I think, because we'll be able to have more people.
Fantastic. For folks who want to know more about what's going on at their Onslow County Senior Center, how can we reach you all? How can we find out?
You can check us out on Facebook. We have a lovely social media liaison who's amazing at her job. And then we also have, you can call 910-455-2747.
Very good. Well, we wish you the happiest of Senior Center months,
Thank
Ashley.
you so much.
Thank you. Welcome back to Onslow County Today, and joining us now is Erica Giles with the Onslow County Health Department. Erica, thank you for being here today.
Thank you for having me.
We just got a really interesting statistic last week that came across our desk. For the 5th year in a row, Onslow County has the highest birth rate in the entire nation.
Yes.
5 years in a row,
Yes.
more babies,
Yes.
more pregnant folks than anywhere else in the country.
Yes.
We're number one.
Yes.
That means that you at the Onslow County Health Department are helping a lot of families with these new people that they're bringing into the world. And the first thing we want to do is make sure that that process, that pregnancy for expectant mothers, is the happiest and healthiest that it can be.
Absolutely.
So we want to find out about your care management program for expectant mothers. Share with us about this program, who it serves, how people can qualify, and what an impact it makes for these moms.
Absolutely. Again, thank you for having me. We work with women who are pregnant up to 2 months postpartum. Our target population are women between the ages of 14 to 44 who are Medicaid eligible.
Okay.
And so what we do with our members is we work with them to ensure that they have a healthy pregnancy, healthy postpartum period. Our goal is healthy moms, healthy babies, healthy pregnancy. So we exist to improve birth outcomes for women in North Carolina.
When we think about one, that age range, right? That's amazing to think about, that 30-year span that we are seeing young women who are expecting. And when for folks who say, well, people have been having babies for eons, literally, what that means, in pregnancy is, while it is a natural occurrence, it is challenging. It can be hard.
Absolutely.
It can be scary.
Absolutely.
you are growing a full person,
Absolutely.
and you all are there really with us through that process.
We provide that supportive services throughout their pregnancy to ensure that their medical needs are met, that they're making their prenatal appointments, that they're going to, they have WIC for their baby, they have WIC for themselves throughout their pregnancy as well as their baby. We make sure that they don't have any housing needs or transportation concerns, which we see a lot of our members struggle with. We want to make sure that they are taking their prenatal vitamins, that if they have any medical diagnosis, that's being addressed throughout their pregnancy as well. Again, we work very closely with their OB provider. They don't have to be a patient of the health department to receive our services. As long as they're a resident, we actually work with Onslow County residents as well as Jones County residents. So as long as they're a resident of Onslow or Jones County, we can work with them. We receive our referrals from OB providers. Members receive a pregnancy risk screen at their first prenatal appointment, and we use that pregnancy risk screen at the end of that appointment to determine if they're eligible for our program. We also receive referrals from community partners like WIC, Medicaid, Department of Social Services. We also receive referrals from members directly themselves who feel that they need our support and need our services. So we can receive referrals from a plethora of places, again, to ensure that that member has a wonderful pregnancy, postpartum period, and birth.
Very good. You know, I was listening to all of the things that you all are there, just checking in, because we don't always do the best job of just taking care of ourselves. Maybe we don't know a lot, and that's not a judgment. Maybe we just are not informed about good nutrition, about the importance of those prenatal vitamins. This is not just a vitamin like we think of an everyday supplement.
Right.
This is loaded with all those things like folic acid.
Exactly.
So the importance of those prenatal vitamins, of making sure that our pregnancy is progressing, that our baby is growing and getting the nutrients that it needs to make its entrance into the world. But what also struck me was what you said about 2 months postpartum.
Right.
So you're not just saying after you have the baby, bye.
Right.
This is about that post care, which is so vital.
Absolutely.
Talk about why that's so important.
Because we want to make sure that mother is bonding with that child. We want to make sure that there are no concerns with postpartum depression.
Oh, sure.
We also, I didn't say this earlier, but we also provide pregnancy education and postpartum education each trimester and through the postpartum period.
Very good.
We want to make sure that mother receives their postpartum care. We want to make sure that they receive their contraceptive after the baby is born at that postpartum appointment. We want to make sure that that member is connected with WIC for their baby, that their baby has Medicaid. So it's a lot of things that their safe sleep, is the baby sleeping appropriately in a crib, a bassinet, a pack and play, car seat safety, is the car seat installed in the car appropriately. And we do have car seat safety specialists on our care management team. Our team is also comprised of a nurse, so we have social workers and a nurse, a part of our care management team. So we want to make sure that all our bases are covered when it pertains to postpartum care with our members as well as throughout their pregnancy.
Well, you know, when we think about our community, so much of our community is transient from other parts of the country, perhaps even other parts of the world. And many of us have been fortunate to have other women in our lives, our mothers, our grandmothers, our aunts. But if we're relocated to this new place, sometimes we don't have that support system. And this is where our Onslow County Health Department step into that gap.
Absolutely.
Talk about the outcomes of how important it is to have that support system, and then what you've seen as a result of the work that you all have done.
Oh, absolutely. So you hit the nail on the head. Informal support is so important, and sometimes our members don't have that. And knowing that we're a phone call away, or knowing that they can come into our office and just talk with us if they have an issue or concern, speaks volumes for the work that we do in care management with our members. And ensuring, our goal is also to ensure that, again, we improve those birth outcomes for our members. So for having that support, having that foundation that person you can go to and talk to, helps you with your pregnancy, feel better about your growing baby in your tummy, feel better about you being pregnant, as well as doing your postpartum period. So that support is so essential, and we in care management provide that for our members. We advocate for them. We can assist them if they need help with a phone call, or in terms of navigating a particular situation. We're there for them to ensure that they have what they need throughout their pregnancy.
Well, Erica, I thank you for what you all are doing for our families in Onslow County, for our expectant moms, for the babies that they are growing and nurturing and bringing into the world. We thank you for all of the education that you provide. And again, you have a big job.
Yes,
We're number
ma'am.
one,
Yes, we
right?
are.
Well, the highest birth rate in the
Yes,
nation.
and I also will say that we do have a community health worker on our team for members who may not qualify for our program, but she does have a small caseload of members that she follows
fantastic.
that don't receive Medicaid to ensure, again, that they have what they need throughout their pregnancy, even though they don't qualify for our program.
Oh, very
So
good.
that's awesome that we can provide that service even for members who may not qualify because they don't have Medicaid for our program.
Well, that is a fantastic, again, opportunity. Last thing I want to ask you, for folks who want to know how to find out more about your program, how can we reach you?
Contact me at the health department, 910-989-3942.
And for folks who may not be aware where our Onslow County Health Department is located?
It's at 612 College Street right here in Jacksonville.
Very good. Well, Erica, thank you. And again, thank you for what you do for our families.
Thank you for having me.
Welcome back to Onslow County Today, and joining us now from the Onslow County Health Department is Bonnie, and it is always a joy to talk with you. Thank you for being here.
Thank you for having me, Lisa.
You know, we talked with your colleague, Erica, about prenatal care and care management for our expectant mothers, but you pick up, as they say, and tell us the rest of the story about care management for children 0 to 5. Talk to us about the goals of the Onslow County Health Department in care management. We know that we don't provide care for illness. This is about keeping the well and healthy and happy. Yes. So we want to know about what you all do for our littles.
Okay, so I am with the care management with the early childhood program. And like you stated earlier, we work with families who have children birth to 5 years of age. Now, the overall goal of the program is to improve health outcomes for those children. So we have care managers, and we work with those families to assist in coordinating their care, linking them to community resources, advocating, working with the families and their medical provider to ensure that the family is healthy and well. Our goal is to ensure that they have optimal health outcomes.
You know, it's about information, right?
Yes, ma'am.
And it's sometimes even about overcoming earlier, maybe how we were taught or raised. There's always new information.
Right.
So it's about nutrition. It's about well care screenings. Talk a little bit about how sometimes you all are in the myth busting business about, you know, what are the best ways that we can ensure that children do have what they need?
Yes, so we are mandated by, we follow state guidelines, so they provide us with educational information that we provide to our families. So we provide that information to our families, and like I mentioned earlier before, we work alongside with their medical providers, community partners. We can form a care team, so work alongside WIG, reach out to community partners such as the One's Place, the early childhood program. So whatever we have to do to accommodate our families and to make sure that their goals are met, that their needs are met, then that's what we do. We like to personalize it. So we work with our families to identify whatever their needs, goals, or concerns are. We work with them to implement interventions, and we also work with them to determine what their barriers to care are. Like, how can we assist them with overcoming their barriers that's hindering them from achieving their health outcomes?
You know, this is about best beginnings.
Yes, ma'am.
This is about foundations. And when you talk about interventions, perhaps it's helping parents understand any differentials that their child might have to learning, or any kind of challenges that they might need a little help overcoming. But also finding out, WIC, making sure that we have the very best nutrition, all of those things. Sleep, how we,
Yes.
the best ways to encourage sleep and the safest ways.
Yes.
And this is always about safety, right? Health
Yes.
and well-being.
Yes, ma'am. Health, and then just to talk a little bit about our target population, like we work with families who have children with special health care needs. They may have NICU utilization. They may be experiencing life challenges, stressors, adverse life conditions.
Yes.
Also, we work with those foster care parents. So however we can support our families, then that's what we do.
We all read, right? When we're expecting, we read all those books. Sometimes we have access, sometimes we don't have access to that information. And even if you have access and you've read all those manuals, maybe that's not your child because that's a generic understanding.
Yes.
Every child is unique and special.
Yes.
and needs that same kind of attention.
Yes, yes.
If folks want to work with you, you receive those referrals. Maybe I'm a neighbor and I've got a neighbor who has a new baby and I think, you know what, let's see if we can get you a little extra help because maybe mom's not here, grandma's not here. How can we best connect with your services?
Okay, and just to make it clear, anyone can make a referral to our program. So we have parents, we have community partners, we have medical homes, we also have our providers. Anyone can make a referral to our program. So the neighbor can make a referral to our program. And the best way to reach me is they can contact me directly, and my number is 910-989-3908, and they can contact me and I will make sure that I connect with them.
Now, the last thing I want to really ask you about is you've done this for a little while.
19 years.
19 years,
Yes,
a little while. And so your 0 to 5s are now
ma'am.
perhaps in their 20s and beyond. What does it mean to you when you've seen the successes of those families and see those little ones who were once 0 to 5 now as adults and young adults and to see them thrive?
It is the best feeling in the world. And we have families that will come back years later to find their care manager, to make sure that they bring their child to the agency so that they can lay eyes on their child and say, hey, this is the individual that you helped. The health department also, we do client satisfaction surveys, and so we get great feedback from our families, and they just speak about how great the care managers are and just the services and that they receive from the Onslow County Health Department. Sometimes we have families come to our office and they're tearful and they just express how grateful they are for their care manager.
This is what a wonderful community connection and relationships that you all have built with always the health and well-being of those children at the forefront. And obviously 19 years.
Yes.
It's a passion.
It's a passion. And I can speak for the entire team. We serve with passion, diligence, and care. We all come to work and we enjoy what we do and we love assisting families.
Well, Vonnie, it is always inspiring to talk with you, and we thank you for what you do for our families.
Thank you for having me, Lisa, again.
Welcome back to Onslow County Today, and joining us now is the Honorable Christopher Thomas, Sheriff of Onslow County. Sheriff, thank you for being here, sir.
Thanks for having us.
In just a few minutes, you're going to leave us because you have a huge program coming up, an informational session with your team. But we wanted to invite you here today to tell us a little bit about your new initiative, which is your Community Service Unit. Tell us what this is and why this was something top of mind for you.
Well, traditionally, we have worked with the communities with a community-oriented policing program, and we've had community watches and try to address small issues in the community. But the demand has increased tremendously with the growth of the county.
Yes, sir.
And there's often times that a matter may not be a huge matter, or a huge criminal matter, or a huge civil matter, but it's a real problem in the neighborhoods. So we wanted to have somebody that could stay longer, that can come back and address and maybe negotiate or settle issues within the communities and try to help build a better relationship between neighbors and with the sheriff's office as well.
I was just going to say, this idea of neighbor. You're the neighbor, right?
Yep.
You live in a neighborhood, you have a neighbor, but our sheriff's office and your deputies are their neighbors as well.
They are, and we have a lot of calls for service.
Yeah.
And we can get a call and the deputy goes and he's trying to get that call cleared and get everything calmed down and straightened out. But he's got calls waiting on him. So he has to handle it as quick as he possibly can and leave. With these community deputies, this community service group, they will be able to go back behind these deputies and address issues in great detail and try to settle the situations, and also get our community watch programs back up and running.
You know, I'm thinking about this idea, and you and I have talked about the history of the sheriff's office and its long history in the county, is in a very modern world, in a county of over 210,000 people, more than, and growing every day, this is sort of an old-fashioned approach to just settling matters and helping and being there, right? It's a combination of both.
It is. We have a lot of deputies addressing a lot of calls for service, and some of them are known in their community. Some of them are recognized, but a lot of times it's a deputy the person's not met. But this will give them a chance for these deputies to get face time with individuals, and they'll know that it's Deputy Smittle. They'll know it's Deputy Shermell. They'll know who these people are, and they'll be able to call them directly, and they'll be able to handle the situation. Currently, I have two.
Okay.
Deputy Shamel is working, and Deputy Donovan, and I think you'll be interviewing Deputy Shamel here shortly. And we're looking to expand on it as time goes by and as demand comes in for it.
And the last thing I'll ask you is, when you think about this and you think about creating those connections and relationships to our community, to the residents of our community, what would you share with the citizens about your hopes for this program?
Well, for them to have a personal connection with the sheriff's office and know that we'll be there when they call us, that we will not only come and address a situation at the moment when maybe tensions are high, but we will come back and make sure it stays that way, that it stays calm, and hopefully correct some issues that may not be big criminal issues, but maybe quality of life issues that we can help with.
Well, Sheriff, we thank you as always. We thank you for these innovative approaches to policing in our communities, and we thank you, sir, for all that you do to keep us safe.
And thank you for keeping the citizens updated on what's going on in the county.
Yes, sir. Welcome back to Onslow County Today, and joining us now is Deputy Howard Shamel. Did I say that correct,
Yes,
sir?
ma'am.
Deputy Shamel, we are so glad you're here. The sheriff has introduced you as one of two of his community service units, special CSU, community deputies.
Yes,
This is a relatively new initiative at the sheriff's office. Tell us about what the CSU goals are and what you all will be doing in our communities.
So our big thing is we're trying to start back our community watch programs. We're trying to activate new ones, reinstate old ones, and just build some awareness in neighborhoods and in the communities, get neighbors talking again. Because everything's social media now. Everything's social media and TV. Neighbors don't talk anymore. We're also there to fill the gaps for patrol. Patrol has a huge call volume. And we're going to try to come in and pay a little more special attention to, I wouldn't call them minor. They may be a big thing at the time, and to you, they may be huge.
Right.
So we want to come back and pay special attention to those things.
Well, you know, what you said first and foremost, this idea of bringing back the community watch, this isn't about being a tattletale. This isn't about being, when we think about, being that nosy neighbor.
It's awareness.
This is awareness, but also connection, right?
Right.
We need to know who our neighbors are so that we can be there for one another.
Absolutely.
And you all are helping to recreate that connection. And in a community as large as ours and one that's transient, sometimes that can be hard to make those connections.
Extremely.
So you all are there for them. So the first thing is bring back that idea, bring back the concept of the community watch program, help one another out. And then, as you said, sort of relieve the pressure on the patrol, because you can be there in a more connected, lengthy fashion.
Yes, we can dedicate more time.
Dedicate more time. And then the other thing is perhaps there are trends in a community, in a neighborhood, and you all will really be aware. You get to know the folks in that neighborhood.
Absolutely. And we want to do targeted crime prevention. We also want to do targeted enforcement. In the neighborhoods, a lot of things that you see now is you see minor car break-ins. You see people coming and jiggling door handles. It's a crime opportunity. And you may see in an extremely large neighborhood such as Peyton's Ridge or Town Creek or one of those, where you have several people coming in and jiggling door handles, and they break into several cars. That's a trend. That's a trend we want to be able to monitor. We want to spend some extra time on it. When patrol's burdened with call volume, we can flex our time and we can come out and do some observations at night and make sure things are taken care of.
And it's also about educating, right? You
Absolutely.
can also work with that community about what you might be on the lookout for. What are things, that sort of sense of, I heard someone talk about something earlier about awareness, just awareness of who are the people in your neighborhood, who are your neighbors, and maybe you've got that, we talked about with the senior center earlier. Maybe you just have an older neighbor who just needs a little extra love and attention.
Absolutely.
And you all are helping us find those folks.
Absolutely.
If folks want to be involved with your CSU, want to know, maybe they want to establish a community watch within their subdivision, how can they best do that?
The first point of contact is going to be Captain Dixon at the Sheriff's Office.
Okay.
They can call and set up something with him, let them know what they're interested in, and we will actually come out, myself or Deputy Donovan, or both of us will come out and speak. We'd like to see, especially in some of the bigger neighborhoods that have HOAs, maybe we can come to an HOA meeting. We'd be
Super
happy
idea.
to come out and talk about crime prevention. I mean, as I spoke about before, people coming up and jiggling door handles because doors are unlocked. It's a crime opportunity. The best way to combat that is to lock your doors at night.
So some fundamental practices, some
Absolutely.
awareness, some connection, and some relationships. This is what this program's all about.
Absolutely. We're here for the people. That's what we're here for.
To be here in the community. Well, Deputy Shamel, I am really excited to learn more as this program grows, and we definitely want to have you come back and share with us. Anything that you would share with our viewers about the program that you're excited about?
I'm excited to get out and work with the community. I mean, that is the biggest reason I got into law enforcement, is to help people and be a part of the community. I live in Onslow County. I'm helping police my own county, and I really enjoy that, and I really look forward to it.
Well, Deputy Shamel, last thing, we can just reach out to the Sheriff's Office, ask for you, Deputy Donovan, or starting with
Dixon.
Captain Dixon.
Yes,
and just reach out to the Sheriff's Office there and let them know that we're interested.
Absolutely.
Well, Deputy, it is a real pleasure to talk with you today, and we thank you for keeping us safe here in Onslow County.
Absolutely. My pleasure, ma'am.
Thank you, sir.
Thank you.
Welcome back to Onslow County Today, and we are here for our September visit with the Onslow County Public Library and Torrey Parks. Torrey, thank you for being here.
Thank you, Lisa.
September, kind of a big deal.
Yes, it is.
What is September?
September is National Library Card Sign-Up Month.
Yay! Now, I have a beautiful library card. I love it. But there are lots of new folks who are moving here to our community
Yes.
that don't know that that card is the passport to all kinds of wonderful things, right?
It is. You can do so many things with that card.
Tell us the value of a free library card.
So with your free library card, you can use it at any of our 4 branches. You can also check out books, DVDs, storytelling kits. You can, even without a library card, you can come to all of our programs. There are really endless possibilities, which is actually the slogan for this year for National Library Card Sign-Up Month.
Endless possibilities.
Yes.
Now, we get that library card. Again, it's sort of that key to all kinds of things. Who can get a library card in Onslow County?
So as long as you are a resident of Onslow County, you can get a library card. And then for children, you have to be at least 5 years old.
And be able to sign your name?
Yes, you have to be able to sign your name.
Okay, so be able to sign your name, and then you get your very own.
Yes.
I know that when my girls were little and I see other kids do this, they carry it around like it is their driver's license.
Oh, they're
real
so
ID.
proud.
They put it in their little wallets, and it's like, oh, let me show you my ID. This library card is so integral to who they are. And you all are celebrating this. Anything special? There's always something fun that you all have.
So we do have some incentives. So if you come sign up for your library card in the month of September, you can get some of our swag. So that might be a cup or a pencil or a bookmark, you know, any sort of different thing, but it will have all of our new branding on it.
Oh, beautiful.
So that way you get to, you know, remember us.
And you know, that branding is so, again, specific to who we are as a place.
Yes.
And this connection to Onslow County. Also, September kicks off the fall.
It does.
And I know you have probably got a new newsletter.
I do. This is our new newsletter. It is, all things fall. It makes me very happy. Makes me super excited for the more chilly weather. So our new newsletter is jam-packed with so many different programs. I believe we have, with all of the programs together, there's well over 115 programs coming up just for this fall quarter.
We've been on a little bit of a pause as we're getting ready. We've gone back to school.
Yes.
Been on a little bit of a pause. So all of the youth programming back full force.
Yes, all of the youth programming starts up again on September 9th.
Okay, September 9th, ready to rock and roll there. You've got book sales coming up,
Yes,
author events. I mean, this is a busy time of year.
it is. And then in October, we're going to have Ren Fair too. So I'll give you more details about that later.
We're so excited about all the fun things that you all do. We're also so fortunate in Onslow County that if you're new to the area, and we do see this is the time of year when that transition happens with new families moving in, tell us how we have libraries situated throughout the county.
So we have our main branch in Jacksonville, which is right near Jacksonville High School. We have our branch in Richlands. We have one in Sneads Ferry, and then one in Swansboro.
Fantastic. But we are not limited to the books that are just on the shelves at any of those locations.
We are not. So we actually send and ship and receive from a bunch of different counties in North Carolina. So if we don't have something that you're looking for, we can order it for you for free, and they will ship it to us, and then we will let you know when it's ready.
The back rooms of those libraries, as you all are, that program shipping back and forth. I mean, you keep some road couriers busy.
Oh, yes.
This is a busy place. Now, last but not least, Tori, we want folks to know how to reach you. You've got this beautiful newsletter,
Yes.
but you also have great social media presence as well. Tell us best way to learn about all of those hundreds of activities and events going on.
Absolutely. So you can find a copy of the newsletter in any of our branches. It's also located on our website under newsletter, and you can click on the fall one. You can blow it up big, check out all the different programs. You can also find us on Facebook, where we post all of our different events happening.
Well, it is always so fun to have you to learn about. It was a great summer.
It was.
A great summer. Time to transition to fall. I was going to make a pun about leafing through a book. I won't do that. But Tori, it is always a joy to have you. And thank you for sharing. And happy Library Card Sign-Up Month.
Thank you, Lisa.
Welcome back to Onslow County Today, and joining us is Becky Knutson with the Onslow County Health Department. Becky, welcome, and thank you for being here today.
Thank you for having me, Lisa.
We're going to talk with you and also one of your colleagues from the Onslow County Health Department, and we do want to let our viewers know that this is a particularly sensitive topic because we will be talking about suicide prevention. So for anyone who might be concerned about the subject matter, we always want to make them aware that this is what we'll be discussing. Becky, when we're thinking about that, we're having you particularly here in September because September is Suicide Prevention Awareness, correct?
Yes.
Tell us a little bit about the importance of awareness, why we're having this conversation.
Absolutely. Our goal is to help reduce stigma that surrounds suicide, raise the awareness so people are more comfortable having these conversations. Conversations are so important and communication is so important. So that's why we're trying to raise awareness.
And you said, erase the stigma because this is a difficult conversation.
Absolutely.
We know that families, many of us have been touched
Right.
by this tragedy. Let's talk a little bit about the statistics. We talk a lot about data sometimes, but numbers tell us a lot.
Right. I think it's important to have the data to discuss it because people don't necessarily know how big of a public health crisis this truly is. So suicide is actually the 11th leading cause of death in the United States, and 49,000 people die by suicide every year in the United States. Onslow County, it's a particular problem. So this is why we really want to talk about it this month.
And when we say that, when you point out that this is a problem in Onslow County in particular, what are those factors? Who are those individuals and those families that have been impacted by this?
Absolutely. We have a high military population, so we know that the armed forces and the veterans are a particular at-risk group. People who work in certain industries like construction are a high-risk group, and people that are facing mental disorders or substance use disorders are also at a high risk. So Onslow County is a uniquely vulnerable area for that.
And what about our young people, Becky, when we think about youth?
Yes, we do have a lot of military or Marines here that are very, very young. They're facing the trauma of being away from families, and it's really something that we need to come together as a community to address.
And I love that you've put that fine point on community. Again, there's been the stigma that's sometimes been associated with this, but if we're aware of our surroundings, if we know that this is the situation,
Right.
we can make a difference.
Absolutely. It's opening up that door to having those conversations. You do not have to be an expert to intervene. Anyone can intervene. And the big thing that I want to highlight is it doesn't matter what job you have. It doesn't matter what gender you are. It doesn't matter what role you have in life. Life gets heavy for all of us. And it takes a lot of courage and a lot of strength to ask for help, and that's something that should be honored.
When we think about the difficulty in making that ask, sometimes those of us who are in the periphery think, this is their story to tell. Do I wait for them to ask? Do I intercede now? How do I put my foot in the door?
Absolutely, and I think that's a really great point. When we give somebody an opportunity to really talk about those big feelings, it lowers their anxiety. It gives them a platform to tell you honestly, this is a problem that I'm facing, and it can help possibly reduce the risk of suicide in people when you open the door.
We make a difference.
Absolutely.
We can make a difference.
Absolutely, we can.
Becky, we're going to talk with your colleague, Dominique, here in a little bit about the roles that we play. But for those who might, and we cannot stress this enough, those who might be struggling in any way, what can you best tell them? First steps, and maybe sometimes they are just so overwhelmed they don't know how to ask for help. What's that first step?
The first step, if they don't have friends or colleagues that they can go to, is to utilize the 988 resource. They are trained professionals who can help walk them through that process, but the main thing is that they ask for help because help is available.
It's here.
It's here.
It's here. Well, as always, we are grateful that everything the Onslow County Health Department does. Again, we remind folks that number one more time, that resource that is just invaluable.
Absolutely, it's 988. It's very important.
Well, Becky, thank you for being
you.
here, and we appreciate everything that you shared with us.
Thank you for having me.
Welcome back to Onslow County Today, and joining us now is Dominique Van Pelt from the Onslow County Health Department. Dominique, before we get started, we always want to point out to our viewers, make them aware that we are talking about a very sensitive matter. We'll be talking about suicide prevention. We know that this has impacted families, and we want them to be aware of the sensitive nature of this conversation. But we also want to know that this is an opportunity to reach out and offer some guidance and some help. We spoke with your colleague, Becky Knutson, earlier about the prevalence of suicide and the means and the need for awareness. But Dominique, what we want to talk with you about too is those next steps, that we are here for those members of the community. So let's begin there. Becky pointed out that first step is asking for help. Talk about you as us as community members, as neighbors, as friends. What should we be aware of? What should we be thinking about if we have concerns about a loved one or a friend in our life?
Yeah, so there can be a lot of concerns with loved ones and maybe coworkers, or even someone that you don't see on a daily basis. You just notice some signs going on. And that could be due to a few different things, like maybe they just lost their job, maybe they're having financial struggles, they're losing their home, and maybe a loss in the family, and sometimes even multiple things at once. So that can be really heavy on someone. So that could be more of like situational clues of someone that may be considering dying by suicide. Some other clues could be maybe how they're speaking, like maybe y'all would just be so much better off without me. And dropping those hints in a few different ways. And it's interesting because I think some people think that maybe just avoiding the topic of suicide, maybe they just won't think about it if we don't address it. And to go back to Becky's point of asking the question is really important, because that opens a that clears the air for an open door of communication with that individual for them to share about how they're feeling.
You know, I think about what you said about one, opening that door, just having that conversation, but also not glossing over it, or maybe it'll go away because, you know, put on a happy face. It's okay. It's not about trying to fix it. It's about being a facilitator and helping that person, right?
Absolutely, and you don't want to just, it's really important, your tone when you ask the question too. So maybe saying, avoid saying something like you're not thinking of dying or killing yourself, are you? And
Right.
we want to avoid those terms. We want to say, maybe in a more indirect manner, how are you feeling today? Just checking in. Is something bothering you? Or in a more direct way, you want to make sure you're in a private space as well, away from other people, and you're not rushing from topic to topic, trying to catch on to that next meeting, losing yourself in the monotony of life, but taking a second to really check in that private setting and say, how is everything going? Is there something bothering you? Are you thinking of dying by suicide? And when we say dying by suicide, sorry not to interrupt you.
No.
Because we want to make it clear that thinking of suicide, there is no commitment involved. You can maybe consider it, but it's not something that you have to do. And that's why we want to step in and ask the question.
You know, I think about the guidance you've just given, and it's about intentionality. It's about being present.
Yes, ma'am.
We've talked about this topic before on Onslow County Today and with members of your team from the health department. And as Becky shared, this is a particular problem here in Onslow County. What do you all recommend as the best way to start that conversation? I mean, you talk about setting, you talk about tone, you know, tone and place, right? Talk a little bit about how you all have guided or coached other members of the community about being there.
Yes, thank you. So we have about an hour-long training. It's called Question, Persuade, Refer, where we talk a little bit more about how to ask the question in the setting, like you mentioned, and then moving into the other steps of very first recognizing the signs and the clues we talked about earlier, asking the question and how to do so in an appropriate manner, because we did talk about this is a very sensitive topic and we want to respect those that are involved. And then persuade would be the next step, giving them reasons to stay, whether that's their friends, their family, they love their job. And after that would be, the final step would be refer. So refer them to care. The best situation would be bringing them directly and say, hey, like the source that Becky mentioned earlier, talking about 988, maybe making the call with them. Or at the very least, the goal is to get them to promise, I will make the phone call myself at a later time. So that's really the main goal.
The QPR that you mentioned, the training, is this open to the public? Is this something that you do for community members? How does QPR work?
Yeah, so we are on the community relations team. If an agency is interested in hosting Question, Persuade, Refer, again, it's an hour long. We try to keep it to 35 people or less to be in more of an intimate setting to answer any questions, concerns, and so on. And that being said, you can message community_relations at onslowcountync.gov. That's our email if an agency is interested in having the training.
So, for example, you had a faith-based group, or
Yes.
you had a civic group who felt called to have this training. They reach out to you. You said 35 members. They come to you. You come to them. How does that work?
Yeah, thank you for asking. I love that you said faith-based organizations. We love to partner closely with them because it reaches another demographic of our community. So that being said, we receive phone calls sometimes of people just looking for more information. That would be a great way to make that connection, and vice versa. So we can actually go in person to the church, for example, and give that training, or we can host it at the health department at 612 College Street.
Okay. Last things, Dominique, we want to just remind folks one more time the value of that 3-digit number if they are struggling in this moment, or they have a loved one, a friend, a coworker. What's that number that we should all be aware of?
Yeah, so we all know the number if we are in an emergency is 911. However, if you're in need of immediate mental health resources, it's going to be 988.
988. And for folks who want to reach out to the Onslow County Health Department, the best way to reach you all.
Yes, our main number is 910-347-2154, and you can ask to speak to someone on the community relations team.
Well, Dominique Van Pelt, as always, we thank you and Becky for coming here and bringing this particularly sensitive but important topic that we all need to be aware of and discuss. So thank you for your time.
Thank you for having us.
As always, we are so glad that you've joined us for Onslow County Today. And a special thank you to our community of guests who are here for you, our community of Onslow County. As always, if you want to learn more about what we do, please visit our website and visit each of the sites. Follow us on social media, because we here at Onslow County are here for you today and every day.